Hey, welcome back. My name is Dr. Sanjay Juneja, also known as the Onc Doc, and I'm a hematologist medical oncologist. These videos are meant to hopefully empower you with knowledge and make you feel more comfortable with cancer and answer some general questions you may have. In a previous video, we talked about staging, and we talked about how generally stages 1 through 3 are usually curable, or like early or locally advanced, and where stage 4 is a cancer that has gone somewhere else. The purpose of this video is to tell you that not all stage 4s are created equal. 30 years ago, generally when something was stage 4, or basically metastasized, meaning it left the primary site where it originated, so a young lung cancer or a breast cancer has now left that site and gone to the bones or gone to the liver, that's a stage 4 metastasis or metastasized cancer. That was very difficult to treat. Nowadays, stage 4 means different things depending on what cancer it is. So for one, stage 4 for lymphoma can still be curable. Blood cancers like leukemia and lymphoma basically mean totally different things than what we call solid tumors or organs, lung, pancreas, breast cancer, etc. Also, head and neck cancer, stage 4, like stage 4A, that's also still curative intent. Then you have things like testicular cancer, where even if the testicular cancer has gone to your lungs or other places, it's still technically considered stage 3 because there isn't a stage 4 in testicular cancer, just because it's so responsive and curable with chemotherapy. So one very important thing that I want you and your family members to know is, again, stage 4s can mean greatly different lengths of survival as well as what is entailed in the therapy. I've seen patients where their family members say, well, it's stage 4, you're going to pass anyway, why are you going to do anything? In lung cancer, there's something called EGFR mutation. I had a gentleman that came in, 90 pounds, lost probably 50 pounds within 2 months, and it was very, very advanced stage 4 lung cancer. He had an EGFR mutation. This is a pill now that he can take, and he did. 50 pounds back within 6 weeks. He's about a year out, having great quality of life, traveling and seeing the things that he wants to do. There are basically therapies and targets we can do with stage 4 now, depending on what kind of cancer it is, that can make people live literally years, sometimes with minimal to no cancer in their body. Another example is breast cancer and prostate cancer. These usually have hormone receptors. For that reason, sometimes they'll go just to the bones, and we can manage these cancers in some instances, sometimes for years, with just a couple of drugs that aren't necessarily chemotherapy. Some people, when you hear stage 4 with pancreatic, which is very difficult to treat and generally does have, months to maybe a year, very generally speaking, can be a totally different story than prostate or breast that went to another place. Another example of stage 4 is sometimes with lung cancer, you may have a place in the brain. It's important to understand that in some cancers, when you have disease in the brain only, we can still go for what's called like a soft curative approach, because you can kind of knock that brain lesion or those brain lesions out with radiation and still treat the lung cancer curatively. It does get tricky, and it's very important, if nothing else, to understand that stage 4 means different things depending on the cancer type. I think the biggest thing that one could do is have that conversation with the oncologist, ask him what the options are, see what the utility is in the biopsy, and what the treatments would entail. Again, options are important. I hope this gives you some additional information. Again, my name is Dr. Sanjay Juneja. I'm a hematologist and medical oncologist, and also known as the Onc Doc. And the purpose of these videos are to give you knowledge and help you through a process, either for yourself or your loved ones, because the more you know, the easier those waters are to navigate. If you have any questions, comments, or concerns, or things you want me to post about, please put it in the comments below. Hit subscribe because I plan on doing several more videos about tumor types more specifically.